Our topic is about effective communication for interprofessional practice. What is communication? It's a process of exchanging ideas, thoughts, knowledge, and information such as that purpose or intention is fulfilled in the best possible manner. Effective communication is essential in interprofessional practice because it carries the responsibility for the success of the team and it offers that patient, effective, and efficient treatment. One interesting quote that we found states improving the effectiveness of communication in healthcare is a global priority. I really like this statement because it shows no matter where you are around the world, it's still essential to have this effective communication in healthcare settings. For those teams who manage to have an effective team communication, they will have a better result in treating patients, they will prevent any misdiagnosis or injury, and they will have a positive work environment. Compared to those who have ineffective team communication, they will delay the treatment, they will cause misdiagnosis, cause medication errors, and even cause injury or death. As we all know, communication is more than verbal and written language. For example, as you can see here in the picture, you will need presentation skills, patient education, you will need compassion, cultural awareness, personal connection, trust, and active listening in order to be effective in communicating with your team members. In addition, based on the article that Dr. Deru have shared to us, there are 9 actions that support effective communications. Engaged listening, that's where you actually hear and try to understand the speakers. Nonverbal communication, such as body language, eye contact, hand gestures, and facial expression. Be concise and clear. Time is important, so you should be concise as possible. Be personable, be nice to others. Speak with confidence, using nonverbal cues such as tone and stance will promote confidence. Show empathy, stay open minded, give and receive feedback. And lastly, consider the medium. Choose any good communication strategies, consciously using them in conversation or meetings.
So, our first article was a level one systematic review, and this article really looked at the root causes of interprofessional communication challenges. And we broke it down into 3 main categories. So, the first is the differences in professional training or values, and the article focused on nurses and physicians. So, they talked about how nurses are trained to be very descriptive and holistic, whereas physicians are trained to be very succinct in their communication. And so this would cause physicians to feel that nurses were providing disorganized or an illogical flow of information, or they were providing too much extraneous information, whereas nurses felt that physicians were inattentive or not willing to discuss goals of a care plan. Also, the hierarchy of care has a negative impact on communication, and we've talked about this in previous weeks, this preconceived notion that one discipline is superior to another. And so, as a result, physicians would feel like their orders were meant to be carried out without discussion, and this would cause nurses to have a damaged ego and decreased confidence, and so they wouldn't communicate due to a fear of humiliation or feeling like their opinion was not valued. And finally, the fast paced environment of the hospital setting in this article also damaged communication, which is true of any OT setting. So, when the environment is fast paced and interruptive, this can cause conversations to be rushed or less genuine. And they pointed out the 2 different types of communication. So, synchronous is preferred, meaning meetings or impromptu conversations, whereas asynchronous communication occurs through whiteboards or medical records, and this can cause more room for error, like Joe Rich mentioned. The article did point out some pros to the differences in nurse and physician training, saying that there's multiple perspectives, and so the differences between each discipline could complement each other and contribute to safe and holistic patient care. However, it did lead to some of these barriers that I mentioned. And so I've also seen in discussion forums people asking what we can do to improve some of these barriers. And this article synthesized many statistically significant studies that found that simulations were the best method of interprofessional collaboration over online modules or trainings like that. And so these simulations increased confidence, self efficacy, satisfaction, clinical knowledge, and just the overall interdisciplinary communication experience. My clinical example relates to the barrier of hierarchy of care. So at Monroe Community Hospital, the physician would often dominate the conversation and would spend almost our whole 30-minute session talking to a patient at times while we just stood in the corner. And he would sort of refer to us as, "You're in good hands with my team," calling it his team, meaning he was at the top of this hierarchy. And so this was very traditional and really damaged our communication. Whereas the physician at Burn Clinic did not view himself as superior, and he would often turn to me right in front of a patient to ask my recommendations on how to splint. And so as a result, I felt very comfortable approaching him with my own questions, and this facilitated our communication. And we were still impacted by factors such as a fast-paced environment, which made our conversation shorter at time, but overall, this physician created a better dynamic between us.
The second article that we found was called What Makes Team Communication Effective, and this study describes the elements of effective communication as perceived by members of an interprofessional primary care team, and it identifies elements of effective communication as defined by those on the team. It was done in a qualitative study, and it implemented a patient-aligned care team, also known as PACT, and this was a model of patient care delivery in primary care settings. These PACs consisted of a primary care provider, a physician, a nurse, an NP, a PA, and 3 supporting team members. And the study itself used a semi-structured interview protocol to evaluate the early implementation experiments of a PACT member. And the interview guided the researchers, and it covered multiple domains, including perception of team formation, team functioning, team member roles and responsibilities, and team communication. The elements of effective communication as perceived by members of these PACT teams were shared knowledge, situational and goal awareness, problem solving, mutual respect, communication that is transparent, timely, frequent, consistent, and parsimonious. One clinical example that I would like to share occurred during my second fieldwork placement. This placement was at a school, and when I first arrived, there was a lot of talk about this new principal that was going to be coming in, and they were hoping she was going to make a lot of good changes because the previous principal had kind of created lots of divides between the staff and wasn't great at communicating the wants and needs of the staff and didn't really provide for them the structure that they needed to work effectively as a team. And this new principal, when they came in and they started to have weekly meetings that really helped bring the team together, and she used a lot of great ways of communicating, and she was transparent and timely, and she let everyone know what she expected of them, and we were able to tell her, what we expected of her as staff, and it made it a lot easier for us to be able to work together and communicate with one another and get what we needed to do done for the sake of the kids.
So the third article that we found is called An Exploratory Study of Healthcare Professionals' Perceptions of Interprofessional Communication and Collaboration. And this was done because information exchange between nurses, physicians, and patients during clinical rounds is often unstructured and patients are not fully included. And the objective of this study was to just explore healthcare professionals' perceptions on effective interprofessional communication and collaboration. So this was done in a qualitative study. So the 48 participants were interviewed in focus groups, and they basically described what they would need to see from their interprofessional team to make it the ideal clinical round. It is important to note that mainly nurses and physicians were included in the study. The rest were hospital staff that had some sort of physician or nursing background. There were no OT, PT, speech, or anything like that. So from these interviews, 3 major themes emerged. So first is the structure of the medical round. So this included preparation, timing, and communication tools. So preparation is pretty self-explanatory. They just wanted each of their team members to come prepared to the medical round, to know what they're talking about before they begin talking. Next, timing. They talked about how rounds usually took place in the morning, which is the busiest time of day. So they were just kind of looking for more flexibility from their team, so it could be done later in the day, and just more flexibility from the whole team. And finally, communication tools. This just referred to alternative means of communication other than just the actual clinical round to ensure the best possible communication. So there were talks of a safety checklist type of thing to use for the patients to reduce adverse events. The next large theme is decision making, and this was then divided into membership, roles and responsibilities, knowledge and expertise, care planning, and learning on the job. So the main thing I took away from this theme is basically recognizing that each member of the team has a distinct role to play and has their own knowledge and expertise that another profession might not have. And they just wanted each member of the team to recognize that and to recognize that each member had a role to play and to respect one another. And finally, the last theme is patient's role, and this was then divided into participating in decision-making process and geographical movement across space. And there was actually some disagreement between the participants as to what the patient's role should be in the decision-making process. Some believed that the patients lacked the right resources to be involved, and others believe that the patients should be involved in the decision-making process. That is their right. That's definitely interesting, especially considering who was involved in the study. I thought it would be more interesting to repeat this type of study with more client-centered professions such as OT, PT, SLP, etc., and to kind of see if this were to change. And my clinical example that relates to the article and to interprofessional communication in general is from my first level 2 fieldwork in the outpatient setting. So in this setting, my supervisor was a hand therapist, and in hand therapy, you often have to be in communication with a hand surgeon. That's because oftentimes the hand surgeon will use a certain surgical method, and that will kind of tell you what type of rehab protocol to use. So I saw a lot of interprofessional communication between my supervisor and the hand surgeon, and a lot of the times it would be my supervisor going to the surgeon and asking questions and everything like that. But I also thought it was really interesting because the hand surgeon would sometimes also go to my supervisor and ask him questions. Most of the time his questions had to do with splinting. So the hand surgeon would ask, how would I splint this patient who had X, Y, and Z presentation? And I just thought that was really cool because in a traditional medical model, the physician is kind of seen as the knows-all leader of the medical group, but this kind of shifts that model, and it's nice that the hand surgeon kind of recognized that each member of the team has a role to play, and he recognized that my supervisor might have some expertise in splinting that he might not have.
Here are the summary key points of our presentation. Remember, communication is more than verbal and written. There are many strategies and tools for effective team communication, and it's important that we're able to identify those possible root cause of communication challenges so that we know what type of action that we will do. Here are some additional resources that we found, such as free website, communication style self-quiz, and YouTube videos. Here are some examples of the result that I got when I took those 3 different self-quiz about communication styles.
Here are our forum questions. The first one is, what have you perceived as barriers in interprofessional communication? And please provide a clinical example. And the second question is, which element of effective communication from the second article do you think is the most important? And the third is, how would a team with poor communication function compared to a team with effective communication?
And this is our references. Thanks for watching.